Michigan's $300 RX Kids program, cash handout or health aid. A major controversy is unfolding in Michigan, where the state's House Speaker is demanding answers about a massive taxpayer-funded program. Republican leader Matt Hull says a maternal health initiative, known as RX Kids, has veered drastically from what lawmakers were initially promised. He's accusing Democrats of using over $300 million in taxpayer money to advance a much broader agenda: guaranteed income for all. The RX Kids program, launched in Flint, gives expectant mothers a $1,500 payment during pregnancy, followed by $500 every month after their child is born. It's now expanded across Michigan, backed by more than $300 million in public funds. The program claims to reduce financial stress for new families, but Speaker Hull argues it's become something entirely different: an experiment in guaranteed income slipped in under the guise of prenatal care. Hull points out a critical difference between RX Kids and traditional public assistance programs. He says, unlike Medicaid or food stamps, RX Kids lacks basic eligibility requirements. They don't check for citizenship or income verification. All states RX Kids, by design, is given to anyone that has a child. He even provided evidence of program officials admitting payments have gone to individuals not legally present in the United States. Another major concern: the money comes with no strings attached. Recipients aren't required to spend it on essentials like diapers, formula, or housing. Hull says caseworkers have even reported seeing funds used for alcohol, drugs, and gambling, although these specific claims haven't been independently verified. Speaker Hull also highlights public comments from RX Kids leaders that suggest a much larger vision. Co-founder Luke Schieffer has discussed expanding the program, linking it to concepts like the expanded child tax credit. And Dr. Mona Hanna, a leader of RX Kids, envisions it becoming a large-scale government program. Hull sees this as a progressive left-wing experiment toward basically a universal income. Adding to the scrutiny, Hull questioned the program's advisory network. His office revealed that prominent Democrats, including a U.S. Senate candidate and the Michigan Secretary of State's husband, were listed as advisors. This advisory page was swiftly removed from the program's website days after lawmakers started asking questions. Hull called the list a who's who of radical left Democrats. Furthermore, a white paper from RX Kids examined voter turnout among its recipients, and the program promoted a voter registration organization called veered. Hull finds this deeply concerning, asking why a welfare program is so interested in the voting patterns of its recipients, especially when it provides no strings attached welfare. In response to these concerns, Michigan House Republicans have cut off new state funding for RX Kids in the recently signed budget, though the program still has access to previously allocated funds. Hull emphasizes that the goal isn't to eliminate aid for struggling families, but to ensure taxpayer dollars go to programs with proper financial need assessments and spending restrictions. He states, "We're going to try to put guardrails around it so that it goes to the people that truly need it."